Welcome back to Upfront. Experts say Wisconsin's kids face a crisis, a mental and behavioral health crisis that's growing. Children's Hospital just changed their name to Children's Wisconsin, and they're launching a big campaign to raise money for 7 specific youth mental health initiatives. Those initiatives would include early childhood and school-based mental health programs. So we're joined now by Peggy Troy, the CEO of Children's Wisconsin. Thank you for your time today.
And thank you so much for having me on your show.
So how would you say Wisconsin stacks up when it comes to behavioral health?
So we know that access to care is very constrained in our state, and that it takes much longer to receive the services that you need if you start to identify a problem in your child that you think is potentially a mental and behavioral health issue. It can take between 1 month to 1 year to get the necessary care. That has led to unresolved mental health issues, which has then also led to we have one of the highest teen suicide rates in the country.
A year is a long time.
A year is a very long time.
How do you fight that? This is a big undertaking.
It's a big undertaking. So what we're already doing and what our plan as it evolves entails is, first of all, early identification. We know that you can start to see signs of potential issues around mental and behavioral health in kids' infancy. In fact, we have an infant mental health clinic at Children's. And one of the reasons one of the things we look for is, particularly in the infant stage, is parental attachment, and then also what's gone on in the parent's life prior to this child being born, because we know intergenerational trauma, unresolved events can lead to mental and behavioral health issues that actually pass on generational. So if we start early and really start to identify the early signs and symptoms, and then get qualified individuals who can start to treat the kids right then and there, as early as an infant, 2-year-olds. So we're doing system-wide now developmental and behavioral screening so that we can tease that out. So then we will have qualified therapists, particularly in our primary care offices, in schools, et cetera, so that right then and there the parents can start to have the conversation. And many times the mental health therapist is adequate. They can do some counseling, some treatment, teaching from the parents, assessment of the kids, and also then we're developing this integrated plan so that if the kids require a higher level of care, we are integrated in a way across our community. So if you need psychologists, psychiatrists, et cetera, we've got that integration that allows then the gateway. We're going to have to add.
And that's one of these initiatives, right, is that screening. So let's say a kid goes in for something totally unrelated.
And we found that in our emergency department this last year, we've been doing a self-reported screen on children 11 and older to determine whether or not they're suicidal. And I can tell you that we've seen several that came in for an ear infection or some other thing, and through this screen we've identified kids that are actually actively suicidal and had to get them immediate care. In our partnership with Advocate Aurora, Rogers, the Medical College of Wisconsin, we're able then to access that next level of care so the kids get the immediate next step and parents don't have to wait, call for appointment, or try to figure out what they're going to do next.
And I know you have 7 initiatives, but just tell me broadly, what is the goal here?
The goal here is to really, first of all, create access. That is one of our biggest issues. You got to figure it out early, create the access. And then one of the other big goals is we're really working hard to reduce the stigma. You know that there's a lot of stigma around mental and behavioral health issues. If your child has cancer, has a heart problem, you're going to tell your family and friends, and you're going to get this outpouring of care and support. Today, if you have a mental and behavioral health issue, you're less apt to talk about it, because too many times it's, well, bad parent, bad child, and that's not the case at all. There are clinical reasons why these things occur, sociological reasons why these things occur, and they need help and they need support.
Why specifically do you think kids in Wisconsin are having this crisis?
We don't know exactly why. We know access to early detection and access to care is a driver, and we're studying other impacts, other ways in which we can discern what is going on. And so today we think it's early detection and access.
And this will cost $150 million. How do you plan to get that money?
So we have a big plan. Because we're going to double the number of the workforce that currently we have today, we have about 130 individuals. We need to double that number. And so the way that we're going to look at it is, first of all, we'll get increased revenue because we're going to be seeing more kids. The other thing is that we're really asking our community to step up, and I can tell you already in this year when we started to roll out these plans, the generosity of the community has been amazing. We've already had gifts from the boat company, from Rexnord, from Kohl's, who are willing to step out there and support this. So we need that. Government funding, federal funding is really important in this, and some things have happened in the state of Wisconsin, like our consultation line that they agreed to fund, where a doctor anywhere in the state can call into this child consultation line and have an expert from the Medical College of Wisconsin, the Department of Psychiatry, give them an immediate help as to what to do with the children next step, and that's across the state.
And speaking of across the state, Children's Wisconsin, located in Milwaukee County, the major hospital that a lot of us know about, but you are across the state, so this effort will be
statewide
in other places.
We're in 47 schools right now across the state, and we actually provide services in 40 communities, and a lot of that is mental and behavioral health, so this is a statewide effort.
All right, Peggy Troy, CEO of Children's Wisconsin, thank you.
Thank you.
Coming up, Milwaukee and Wisconsin facing a brain drain. We'll ask a city leader about his proposed millennial task force.